Today's presentation is going to focus on proper lifting technique to avoid back injury. I think it's fairly clear for most people that we know that lifting improperly can lead to back injuries, whether it's an acute injury or a cumulative injury, which is often the case. It isn't a one-time effort. It's what you do day after day, session after session that may lead to the injury. So we're going to talk today about how we can avoid the micro tears that might happen to your discs, which, by the way, don't necessarily cause pain in the early stages. And that's one of the concerns we have, is that people have an idea that if I do something and it doesn't hurt me or I don't feel it, then it must be okay. And that's not necessarily the case. That damage to your discs can be something that is cumulative, and although you don't feel pain early on, eventually that may lead to a more traumatic back injury. So let's start with what we should know at this point. Most people, it seems, at this point are familiar with the negative way of lifting, which is what we now refer to as back lifting, where you simply bend over at the waist and lift something off the ground. The problem with that is that it puts your discs, especially the lower discs in your spine, at great risk, because you have the full weight of your upper body plus the weight of whatever you might be lifting, all putting force on those discs in your lower back. We estimate that the load you're lifting, that weight is multiplied by about 10 times because of the leverage problem. Now here's what happens. For a lot of us, we're pretty much aware of that. Even in a work environment, I have seen people who will use that technique day after day, week after week, month after month, and the problem is eventually it results in an injury. But that's not the only time that it happens. For a lot of us, if we dropped a pencil on the floor, we bend over to pick it up. We get home from work and we have small children in the house, we bend over to pick them up. We want to get something out of that bottom file drawer, we bend over to get it out. It's always wrong. That's the point. So you don't have to have a lot of weight that you're lifting for it to cause problems, because the full weight of your upper body is being put onto those lower discs. Now, some years ago, we tried to come up with an answer as to how to avoid that, and we know that your spine should always maintain the neutral spine position, which is the 3 normal curves. So the direction we gave most people was that as you lift, keep your feet shoulder width apart, keep your back straight, bend your knees, and lift with your legs. That should sound fairly similar to what you've been told over the years. And we actually showed pictures in many cases of how people should lift safely or could lift safely, and these were the pictures. Since people don't often do that, instead they tend to bend over, we try to determine if in fact it was because that particular technique doesn't work very well. So we looked at it more critically. Again, we're not only concerned with the position of your spine, we're also concerned with other things. For example, what we found was if somebody were to follow that instruction, they tended to rock up onto the balls of their feet, which isn't surprising since that's exactly what we showed in the instructions. They tended to bend their knees all the way down to the full 65 degrees, which again isn't surprising since it's exactly what we showed them in the graphics that were supposed to display safe lifting. And because of the knee position, it meant that the load you're lifting was way in front of your center of gravity. That meant when you're balanced on your toes and you initiate the lift, there's so much weight going forward, you tend to lose your balance forward. So we tried to determine at that point, is there a better or safer way of lifting? And it's about aligning your body to the task. Trying to figure out what is the best place and way to put my body to be able to accomplish this task with the least amount of negatives. So we have what we now refer to as the sumo style, and here's what it amounts to. Instead of approaching the load from the side, you approach it from the corner. Instead of a shoulder width stance, you use a wide stance. You will still have to bend your knees, of course, we want you to do that, but you shouldn't have to bend them past 90 degrees. You can keep the neutral spine or the 3 curve spinal position. The load will be much closer to your center of gravity. And if you lift your head and your torso as a single object, you'll find yourself lifting straight up and down like an elevator instead of bending over and lifting like a crane. So let's show some quick pictures of that. The idea here is that if you approach from the corner with a wide stance, it allows you to get the load closer to your center of gravity. It allows you to get your feet to stay flat on the floor. You can see on this one, feet are flat on the ground. Knees do not have to bend past 90 degrees. Spine stays neutral. And if you lift your head and your chest as a single unit, you tend to lift straight up and down like an elevator instead of bending over like a crane. And this is accomplished because your knees are out of the way. So it's not complex to change your lifting style. It just takes a little practice, a little experimentation to figure out this is a safer, better, stronger way to lift. Now another consideration in lifting a load is the presence of handles. Generally speaking, handles are on the top of a container, limiting the length of the lifting stroke, and it gives you a place to firmly grasp. Now, if in this particular case I showed somebody lifting a child, children have natural handles under their armpits. By using that as the natural way to lift and using the same technique, wide stance, drop your center of gravity, grab under their armpits and lift them straight up. It allows you to be in a much stronger, safer position. If handles don't exist on the container you're having to move or whatever the object is, then what you do is you use the same body position, but you tilt the load towards you in order to elevate one side off the ground and create handles or places to grab securely on the edges or corners. If an object is too tall for you to be able to bend it towards you, then what you do is you push it away from you and you step around it, and that gives you the same ability to have both hands in a sturdy, strong position in order to be able to execute the lift. Golfer's bend. You may or may not be a golfer. I'm not, but I can tell you that what we did observe was that golfers often would put their hand on the end of their putter and balance on the opposite foot in order to get the ball out of the hole. We tried to determine if that was a good way of moving, and of course it was, because when your hand is supported on a sturdy object and you're balanced on the opposite foot, you don't round your back to extend your reach, you rotate at the hip. So this allows you to rotate or do what we call a hip hinge, which is the way your body is designed to move, not rounding your back, but rotating at the hip in order to extend your reach. Where would that apply? Anytime you're lifting into reaching into a deep bin, picking something light off the ground, even getting something out of the back of a pickup truck, by standing on one foot with the opposite hand supported, you can reach forward and be able to drag something towards you, never having to round your back. So there are lots of places where this particular technique might work. Tripod lift. Well, what's this? Well, sometimes what happens is you have something that is on the floor and difficult to get to, and so we tend to bend over and try to maneuver it into place. I'm going to suggest to you that a much smarter thing to do, instead of this, would be to drop down to one knee. Now the one knee position is a very solid position. 2 feet on the ground and one knee, 3 points of contact. Very stable, allowing you to maneuver yourself and the load effectively. And then to actually stand up with the load, you would take the container, put it on your leg. And then by simply pushing down on the container, it would push you right back up to the standing position. This dropping down to one knee is a position we recommend to anyone who is having to work close to the ground. It's a much more stable position and allows you to maintain that neutral spine. Lean support technique. Now, if there happened to be a circumstance, and the example I'm going to use now is the trunk of a car. Generally what we do, if we're taking that vacation or loading things in the car, is that we simply bend over, rounding our back, which puts our muscles at risk and our discs at risk, and hopefully be able to get something in or out of the trunk. Now we can change the mechanics of that dramatically by simply pressing your thighs into the bumper of the car. What does that do? Well, it changes the fulcrum from your lower back to your thighs, and that means that your spine can stay in its neutral 3-curve position, so the muscles are engaged and the discs are no longer exposed to that particular force, allowing you to put things in or out of the car more effectively. Bracing. Anytime you can use the stabilizing effect provided by using hand or arm on a stable surface, it allows you to reduce the pressure on your spine and increases your base of support. So whether you use your own body by pushing on your leg, as an example, when doing a one-handed lift off the floor, or leaning on a solid object, what it does is it allows you to bend forward, still using the hip hinge position, but in a way that allows you to use the strength of your upper body along with the strength of your lower body to be able to lift the object. By the way, we estimate that by putting your hand on a sturdy object, that you increase the strength, your lifting ability by 1/3. Not that we want you to be lifting more, but what we want is that the things that you do lift become easier and less likely to cause you fatigue or injury. So here's some quick thoughts, tips if you will. Always get as close to the load as possible. You don't carry things out here, you carry them in tight to your body. By using that wide semi-straddle position, it allows you to keep that load under your center of gravity. Avoid picking up loads that are placed below your knees. Wherever possible, stack things, palletize and forklift, do whatever you need to do to try to keep the things you have to get to higher and not directly on the floor. And if you're faced with an item that's you think is unsafe for you to try to lift, get a mechanical lifting device, break it down before you attempt to move it into smaller parts, or ask for help. Don't put yourself at risk. Nobody wants you to do that. Keep the 3 natural curves of your spine. That is how your spine is in its strongest, most stable and safe position. Tighten up your core muscles as you lift, because the primary function of the core muscles is to stabilize your spine. Move your feet. To change directions, you don't twist your spine, you move your feet. That allows your shoulders and your pelvis to stay in alignment at all times. Stay in good physical condition. Now that's a little outside the scope of this particular presentation, but we know that if you are stronger and more enduring and have a better base of conditioning, your risk of injury goes down rather dramatically. And of course, stretch and loosen up before work. If your work is manual, it makes sense. Just as with an athlete, we would always warm them up before putting them on the field or the court or the ice. In your case, we think if you're going to be doing manual work, by doing some sort of stretching and warming up, you may dramatically reduce the risk of injury. Be smart, be safe, and thank you for your attention.